Welcome again to today's webinar, Creating an Audit Plan for Telehealth. This is Ryan Boggs. Today's webinar is presented by both DHG Healthcare and Jones Day. This is the 7th webinar of a series on telehealth, and excited to be here today. A very interesting conversation we're going to have, a presentation. As I said, this is Ryan Boggs. I'm a managing director in DHG's advisory practice and lead our healthcare information technology compliance services. Been with the firm 11 years and excited to be here today to help moderate today's conversation. We have a very interesting topic today. You can see on today's agenda, we're really going to be diving into all things auditing around telehealth. We've got three great panelists today. They're going to talk about reimbursement and compliance and audit and quality and auditing around those areas. And then we're going to end today's conversation with a sample audit checklist for you to consider in your organization. Please use the chat function for any Q&A. If we don't get to any questions today, we will respond to those at the conclusion of today's webinar. But as we think about the webinar series that we've all gone through the last 7 webinars, we really just want to end today's webinar with the collaboration with Jones Day. Both DHG Healthcare and Jones Day bring a broad spectrum of experience in telehealth. And so as you go through today's presentation and even maybe revisit some of the prior presentations, keep Jones Day and DHG in mind. If you have any questions, feel free to use us as a sounding board as we collaborate together to bring solutions to you as organizations that are working in the telehealth environment and seeking solutions to offer those patient services. As I mentioned, Jones Day is with us today. Jones Day is a full-service firm with over 2,500 attorneys around the world. They bring extensive experience in the telehealth space, especially in today's topic around compliance and quality and reimbursement. And as you can see, with Jones Day, we have a full range of experience here. It's interesting today as we think about auditing, we were going to be touching multiple aspects of the digital telehealth regulatory space, especially on the reimbursement side, fraud and abuse, and also quality. And with that, I'm going to turn it over to our panelists for introduction. And Ann, I'll let you start.
Good afternoon, everyone. I'm Ann Hollenbeck, and am, of course, delighted to be here with you this afternoon. I've been a healthcare lawyer for more than 20 years, working primarily with healthcare providers, and have focused a number of years on digital health matters, which include questions and challenges focused on reimbursement, as well as pharmacy offerings. Have also worked in recent times with clients seeking to do virtual, also known as centralized clinical trials. And of course, with all of those come fraud and abuse matters. We focus a lot on the structuring side of things to get things up and running. And then, of course, once they're up and running, we assist with looking at auditing and compliance issues. And of course, that's what we'll be focused on today. Next up, I'll turn it to Rachel to introduce herself.
Good afternoon, everyone. Thanks for joining us. My name is Rachel Ludwig, and I'm also a healthcare attorney with Jones Day. I practice out of the Washington, D.C. office. And like Ann, I primarily represent a wide variety of healthcare providers and with respect to various strategic transactions, as well as providing regulatory and compliance guidance. Spend a lot of time in the telehealth space as well, and in the compliance space generally, and really enjoy this area and all of the complicated aspects with respect to licensure, scope of practice, reimbursement, and fraud and abuse issues, which I'll be touching on a little bit later. Next up is Jill.
Thank you, Rachel. Good afternoon, everyone. I'm Jill Griffith, and I'm a senior manager with DHG Healthcare's National Reimbursement Practice. I have over 30 years of experience in the healthcare reimbursement and compliance arena, and I focus on payments impacting hospitals, physicians, and also post-acute providers. Next slide, please. So we can't really begin to talk about telehealth impacts and audit plans without first looking at the environment. Anytime you think about validation, monitoring, and auditing, always the environment comes into play. And to set the framework for this discussion today, where we're going to talk about sort of before, during, and after the public health emergency, I thought it would be good for us to take a look at some headlines over the past couple of years regarding audits of telehealth that CMS has performed and also performed by the Office of Inspector General. So I've put a few of these on the slide, and just to highlight a couple. The first bullet, most Medicare telehealth claims fail documentation audit. And then if you go down to the middle of the page, CMS paid out $3.7 million for telemedicine that shouldn't have been covered. And the OIG says CMS should conduct periodic post-payment reviews. And you know, the regulatory climate is always going to be ripe for review and declarations of overpayments where the rules are complex and often confusing. And I really can't help but think that we are in the height of just such that time right now where everything is changing at light speed. It was interesting this morning. I thought it was timely. I received an email and I was looking through the subject line and it said, early trends of Medicaid spending during COVID, and something like where to expect future audits. And I thought that was very timely because, of course, when I went into the article, it described that the expansion of telehealth and telemedicine is going to be one of the hottest topics for both the Medicare administrative contractors and the recovery audit contractors as we move forward and go into the future. So when we start thinking about putting together an audit plan for telehealth, we would recommend, you know, there are many, many considerations, but we really want to focus on three of those key considerations today. How you're going to ensure proper payment, how you're going to keep getting that payment by being compliant with all of the regulations, and how quality overlays everything we do in healthcare. Next slide, please. So as we mentioned on the last slide, the environment has a large impact on really not only the need to perform monitoring and auditing, but also what services are going to be included in the list that you're immediately going to pay attention to. And I think telehealth has to be at the top of that list because over the last 2 months, patients have felt concerned. They've almost even been afraid to come into the physician office or the clinic settings. As volumes began to decline, there was a need to really adjust at a rapid pace. Survival has been everybody's mode of operation, especially independent practices and sole practitioners. And the telehealth programs that we've seen crop up, well, some are just merely a continuation of already existing, well-defined telehealth programs, but some are brand new and got themselves up and running with equipment, education, and saw the first patient within a week. And as you know, anything done with speed is going to introduce room for plenty of errors. So the risk all boils down from a reimbursement perspective, of course, to compliant billing, and any payment's going to be at risk. And what adds to the complexity and the need for the rapid review is the addition of all the rule changes that are occurring on a daily and if not daily, weekly basis at a minimum. And they all seem to be coming with the statement that this change is retroactive, and often that date is March 6th. Of course, we have some codes, especially in the lab testing arena, that didn't become effective till April 1st or perhaps even April 14th. So when you start thinking about auditing and you're looking at payment, one of the first things you need to look at is your timeline. Because when you're reviewing claims for appropriate payment, you have to make sure that you're applying the rules that are going to be for the correct time period. And not only that, but for the particular payer that you're reviewing, because we have different directives from the different payers right now on how to bill and code. I think some of the key areas to focus on when you're reviewing for appropriate payment are things like Insurance information first, look at your demographics. Was the insurance verified? That's crucial if you're doing a pre-bill review. If you're doing a post-payment review, that's going to be evident from the remit. You're going to ask yourself, does documentation support the codes that you build? Because if the EMRs were not changed for the new coding rules, and from discussions with many of you, there just hasn't been time for that, then you could be coding and billing at an incorrect level, and potentially really even a lower level. Because remember, during the public health emergency right now, we can use either time or medical decision-making solely for determining the E&M level for the service. We have to make sure that we're using the appropriate place of service on the 1500. We have to make sure that we have the appropriate modifiers. We have the new CS modifier, which means cost sharing is waived and there's no coinsurance if there is COVID-19 testing involved for the service. We have the 95 modifier for telehealth services, where we're all used to using 02. We have new condition codes, such as DR for disaster relief for the institutional billing, and we have CR for catastrophe relief for billing Part B. And add on top of that the fact that other payers differ on whether they want us to use these codes at all and when we have to use these codes. So we need to check with our payers and make sure that we know exactly what each payer needs. I would recommend that we put together grids that show, for your particular payers, what their coverage item is, what they require, and also having a timeline in front of you of when these changes occurred is going to be important as you're performing your audits. As we come out of the pandemic, we don't really know how many of these waivers are going to stick, I guess, if you will. Blue Cross Blue Shield of Tennessee, they stated just in the last couple of weeks that they're going to continue some aspects of changes post-COVID-19, but we're really going to need to stay diligent and focused on things like definitions, because if they revert back to prior definitions, which it's only been 2 months and it's hard to even remember what the definitions were, but remember that originating site used to mean the patient had to be in a rural setting, and that is no longer the case. So we're just going to need to watch this. I don't think it's going away. I think validating and monitoring telehealth services and payments, that's going to become part of your billing and compliance audit plans for years to come. So I'm going to turn it over to Rachel to discuss some compliance considerations.
Thanks, Jill. That was an excellent overview with respect to a lot of the reimbursement pieces that need to consider for developing a fulsome audit approach. I'm going to spend a few minutes talking a little bit more about the compliance aspects. These are general requirements, mostly state or federal requirements as it relates specifically to telehealth services that you want to be sure that you're complying with. And, many of these requirements are built into the payer requirements as well. And so if you don't meet these requirements, then you're likely not going to meet the payer requirements either. So these are particularly important. First, I think we'll focus for a few minutes on sort of the professionals and providers aspects and start with licensure, which is one of the most important pieces to the puzzle when you're talking about telehealth. And, for in-person services, licensure is really where the provider is located because that's where the service is being provided. But for telehealth, most states have determined that telehealth services are provided where the patient is located, regardless of where the provider is located. So, providers actually have to be licensed where their patients are located as opposed to where they're located, which can create some burden on providers if they want to see patients in many different states. And each state has its own licensure rules and requirements. And so it's something to think about as we're seeing a lot of practices just sort of pop up into the telehealth space. There are a lot of licensure waivers currently with respect to COVID-19 that are allowing folks that aren't licensed in the state where the patient is located to provide services due to the emergency. But that may not always be the case. Those waivers may be limited in time and temporary. And so it's important to think about going forward as we move past COVID-19, and you want to continue to offer telehealth services. what that looks like and whether the licensure requirements will really change and revert back to the original concepts where the provider would actually have to obtain a license in those states. So similar requirements with respect to practice standards for telehealth, really thinking about whether there's any prerequisites to provide the telehealth services. A lot of states require that there be a pre-existing patient relationship and an in-person examination done before any telehealth services are provided to that patient, or before remote prescribing is done with that patient. So these standards also, in many cases in many states, have been relaxed to some extent to provide flexibility during the COVID-19 pandemic, but it's, again, very likely that these may be rolled back and the pre-existing practice standards may be re-implemented in the future. And so, again, to the extent that the providers are seeing patients that are located in multiple states, there's really a lot to consider with respect to each state where the patient is located in, and making sure that the provider meets all of those state requirements, which could be in multiple states and different types of requirements. For supervision, this is really pretty standard. There's supervision requirements for telehealth services just the way there are for in-person services for advanced practice providers. Again, it's based on where the patient is located. Those are the requirements that you would be looking at, and they vary from state to state. There has been quite a bit of relaxing of these requirements even prior to COVID this year. So there's been a lot of change in this area to begin with. And then again, of course, we've seen quite a few different types of waivers as it relates to COVID-19 for supervision, either completely removing supervision requirements or relaxing them so that physicians can oversee a larger number of advanced practice providers, or that they have less documentation and direct oversight requirements. So again, it's important to understand what those requirements are in each state where your patients are located, and then making sure that the strictest requirements are being met so that then you don't have any issues across your patient base. And I think Jill's idea of making a grid to track all of this information is exceptional and could be implemented in these areas where you're talking about really a state-by-state analysis and where your patients are. So I'll touch quickly on patient records. Jill mentioned documentation. Obviously, this is important for reimbursement. It's also important to meet the basic state requirements to maintain and timely record the telehealth services and the examinations. And so, you know, to the extent that you're reviewing documentation for payers, it's also important to review to make sure that you're meeting the state requirements as well, some of which are quite specific in the telehealth space. And then the last thing for professionals that I wanted to touch on quickly is insurance, which is more of a practical consideration as there have been all these licensure waivers and people have been providing services to patients in states they wouldn't necessarily have previously provided services. Really important to make sure that the provider's malpractice coverage specifically covers telehealth, because maybe the provider didn't previously provide telehealth services, but also that the carrier is licensed in all of the states where the services are being provided so that there's appropriate coverage through that carrier. I'm going to switch gears for a second to discuss quickly informed consent, which is another area of compliance that's really important to track. Just like other services that are provided in person, telehealth requires some informed consent in certain states, and that's basically describing the risks and benefits of the telehealth services. Documentation is typically required in some form. Some states allow verbal consent, other states require written consent by the patient. So it's important to know what the base level requirements in the state where the patient is located is, and then to make sure that the providers are appropriately documenting the consent in the record, both for the state compliance and for payer compliance as well. And it's important to note that just because the state requires something, a payer could require additional information or have a different threshold in terms of informed consent. So it's really, the grids could really be key in keeping track of everything that you need to do for where the patient is located and which payer they fall under. And then I just wanted to quickly mention that there's a number of other considerations for compliance that you'd want to include in a comprehensive audit. And we don't have time to touch on them today. They could be entire sessions in and of themselves. But obviously you want to consider the privacy and security of your technology platforms, any potential fraud and abuse issues with your relationships with physicians. And then in terms of structuring your entity to provide telehealth services, considering the corporate practice of medicine doctrines in the states where your patients are located, as well as any credentialing requirements by hospitals if you're providing services on behalf of hospitals. And with that, I'm going to turn it over to Anne to talk more about quality.
Great, thank you. So Jill touched on reimbursement as an issue. Then Rachel talking about compliance. So I'm here rounding out the third category here, which is quality and the importance of auditing that. And, you know, as we all know, we sort of have the before pandemic, during pandemic, and then the post-pandemic period of users with telehealth. Some already, of course, had tried it and liked it for certain types of care. Others, many of us, I think, grateful to have that opportunity during these stay-in-place orders, et cetera. And then, of course, so many of us are hoping that telehealth is here to stay and will be a new modality that users are quite engaged in going forward. And so in that context, you know, quality is paramount, and it's something that will be viewed not only by patients and, of course, their families, but as employers and other payers look at telehealth as an option for enrollees and employees. It'll be something that they're all looking at very carefully. So obviously, you know, the key is considering how to measure quality in the telehealth modality in a way that demonstrates that as a provider, telehealth is high up on the attention list for tracking quality, for ensuring quality. And so here on this slide 11, I've listed just a couple of examples for quality measurement. One would be patient satisfaction surveys. Another would be looking at outcomes that would focus on certain disease management measures. You know, an easy example of this is diabetes information. You know, tracking, does telehealth help patients maintain their sugar levels, et cetera. So tracking that and putting attention to these measures is important. Now, the key next question relates to once that data is tracked and there are follow-ups on issues and patient satisfaction, or hopefully not too much, but on patient dissatisfaction. As a lawyer, I start thinking about, okay, we of course want to do all this in a robust fashion, but we want to do it in a way that we're mindful of protecting the provider from lawsuits and discovery of what's traditionally considered to be peer review in the case of a malpractice claim. So peer review privilege, which I'm sure many of you have been involved with in the traditional provider setting, as you can imagine, it is not really a privilege that was ever designed or utilized with telehealth in mind. And as a result, there are some challenges that it presents. And so I want to delve for just a minute into the options. Peer review has traditionally been a state law creature, and each state has a different set of provisions as to how it works. Some states, it's important to point out, simply have no peer review privilege protection in a physician practice setting. So in other words, when a group of physicians is discussing a problem that has taken place with a patient, there's no privilege protecting that, and it is discoverable by a plaintiff's attorney. Of course, we would want to figure out how to protect that. So in those states, physician practices routinely will partner up with hospitals who have the privilege protection, and they look to hospitals and patient safety departments, et cetera, for help with that to avoid that information being discoverable in a malpractice case. However, you can quickly imagine if you're providing telehealth services in a variety of states, or even just 2 states, it quickly becomes clear that, gosh, how would we make that work with a hospital in a different state, and how could we do that with more than one hospital? So the answer is looking to the federal privilege protections, which are provided via the Patient Safety Quality Improvement Act. And this is a really powerful privilege that protects analysis and deliberations for patient safety organizations, which we would help you create, and protects that participation. In this case, state law is preempted, and the protections are really considered to be broader than many state law privileges are. In this case, a provider enters into a contract with a patient safety organization, and it's protected by virtue of that relationship. So the bottom line here is that we're here to help with that piece. It's a complex piece, but as you can imagine, it's an important piece. So with that, I'll bounce it back to the group for a quick run through on slide 12.
Thank you, Anne. So when you start putting together your checklist to begin creating your audit work plan, you can just begin by asking yourself some of these key questions that we have on this slide, such as, do your services qualify as covered telehealth services? We've had an expansion up to 80 services now. Are services documented and coded accurately? Was the correct insurance billed? You have to take into consideration Medicare secondary payer, even on these claims that we're talking about that are telehealth. Were all of the modifiers correct for the time period that we're talking about under review? And the next one, were providers allowed providers under the payer requirements? Remember, those have been changing. In the beginning of our pandemic, we could not use telehealth for physical therapy providers, but about midway through, that changed. So just ask some of these questions around reimbursement, and that will get you started for your work plan. And now Rachel's going to talk through a few of the compliance items on the checklist.
Thanks, Jill. So I just hit the big ones here. Are the providers licensed in the states where the patients are located? It's going to be key, and it's going to be something that you need to think about in the context of the time continuum that Jill mentioned, whether it was pre-COVID, during COVID, or post-COVID, because the licensure requirements may be different for all of those different time periods. That's also true for whether the providers were acting within the scope of practice in each state, as there have been waivers for the scope of practice that I mentioned earlier. And so it's really key to identify the time period of claims or services that you're looking at when answering these questions, to be able to appropriately understand what the requirements were at that time. And same thing with the documentation of patient informed consent. This one, there haven't been waivers really on this. It's pretty much a necessity, but the key is really making sure that the informed consent matches the state requirements where the patient is located, as well as the payer requirements for that patient's insurance coverage. And then I'm going to turn it over to Anne to finish up.
Sure. Real quick on the quality piece is really just looking at patient satisfaction surveys and using those, considering is there adequate quantity of those, and then looking at the quality measures reporting. Are you getting meaningful data? Are you seeking the right information? With that, turning it back.
Well, Jill and Rachel and Ann, thanks so much for all the insight on auditing telehealth. Just a reminder for all the attendees, this is the last webinar of a series on telehealth, and you can see on the slide that we've listed out the links for those slides and the presentations going back to the first one on April 30th. And before we conclude, I just want to go over the disclaimer. Jones Day presentations should not be considered or construed as legal advice on any individual matter or circumstance. The contents of this document are intended for the general information purposes only and may not be quoted or referred to in any other presentation, publication, or proceeding without the prior written consent of Jones Day, which may be given or withheld at Jones Day discretion. The distribution of this presentation or its content is not intended to create, and receipt of it does not constitute an attorney-client relationship. The views set forth herein are the personal views of the authors and do not necessarily reflect those of Jones Day. And with that, I want to thank you for attending today's webinar. Again, please consider reaching out to DHE Healthcare or Jones Day if we can provide any assistance. Thanks again.